In tonight's special report, getting medical treatment can be scary enough. Then, when you factor in the financial burden, well, it can get really scary.
It sure can. So making the right choices can make all the difference. Fox 21's Craig Coffey breaks down the bottom line when it comes to the price of being a patient. Craig.
Joe and Lauren, Parkview Medical Center CEO Michael Baxter says, quote, as we as leaders in healthcare have tremendous opportunity to improve, and that there's a lot of great stuff in terms of reducing costs. So what does this mean for you? Who is responsible for what you pay, and what can you do about your medical future?
The business side of the medical healthcare system is not logical, not easily understandable, and not one we would replicate if we did it from scratch.
Strong words from Chief Executive Officer of Penrose St. Francis Health Services and St. Mary Corwin Medical Center. Margaret Sabin uses a grocery store analogy describing healthcare. 3 shoppers, one pays full price, the second gets a discount, and the third might not pay at all but still needs groceries.
The average of the 3 needs to cover the costs of the organization.
It's cost shifting, where those who can afford to pay make up for those who cannot.
It doesn't benefit us to spend a lot of time, energy, and effort going after somebody who we know doesn't have the means to pay for a medical bill.
Michael Baxter, president and CEO of Parkview Medical Center, says they try to focus on efficiency to minimize this necessity.
You know, obviously, if nobody paid, we couldn't keep our doors open.
So when it comes to procedures and profits, when consumers transition to patients, health executives say the public sets the bar for pricing because now there's more transparency within the system. And the discrepancy and the giant gap between higher and lower end levels of payment, like in the grocery store example, will change.
It's going to narrow, and it will continue narrowing, but it's going to take time.
By law, hospitals must charge the same fee for each service to every patient within their care. When it comes to cost variation from one institution to the next, pricing will differ for reasons like patient severity, payer mix, treating patients from assisted programs like Medicare and Medicaid to the uninsured utilizing charity care, policies established by the hospital, and privately insured patrons. Also, new technologies, labor cost, and a range of services all play a role in what goes on the final bill. According to the Colorado Hospital Association, consumers researching the best fit for their financial need is available. With a quick comparison, the average cost for moderate to major care at Parkview Medical Center is between $37,600 and just over $48,000, ranging from 3.5 to almost 6 days of care. At St. Mary Corwin Medical Center, the average cost for the same classification of treatment is between almost $37,600 to $41,000, length of stay ranging from 3 to 4 days. And at Penrose St. Francis, moderate to major care is listed from $29,300 to just under $45,400 for almost 3 to 5 days of care.
Whether it's our facility or other hospitals, just try to stay proactive, seek out support, seek out help, and there are so many great resources out there right now.
With competition from urgent cares and other freestanding walk-up type clinics on every corner in every neighborhood, medical institutions are also changing the way they do business.
Hi, this is Lauren.
Pricing for certain common procedures or testing is dropping, and they encourage the choice one makes for these services be made with knowing that hospitals have the full support of the healthcare industry in the event of complications.
I think our job as a society is to make services available to the patient within an umbrella of them getting the right care at the right place at the right time. Huge costs are sometimes the outcome of perhaps inappropriate care in the wrong place at the wrong time.
Executives at Penrose St. Francis in the Springs, as well as St. Mary Corwin and Parkview Medical Center in Pueblo, all say that patients have choices, not necessarily when they're in the hospital, but actually choices that begin much earlier in life.
Patients underestimate the amount of power they have in avoiding disease. 75% of disease is absolutely preventable through lifestyle.
Big picture, do a better job with your own personal wellness, take ownership of your health, and try to be proactive in how you seek out care.
I find that some patients know their car deductible better than they know their own deductible. So we've got to apply that same stewardship to the choice of what couldn't be anything more precious, but the stewardship of our own body.
Healthcare providers agree there are a few more simple actions consumers should be aware of to avoid becoming a patient statistic. Know your plan. Pick a plan that works for you and your family. Know what's covered and what's not. Know how much out of pocket you will spend after your insurance covers the balance. And make sure you have a primary care physician and use them. These should be a first option for all healthcare needs to avoid any long-term out-of-control condition.
We take better care of our homes than we do of our bodies, and we let things go. And when we let those things go, they turn into something that can be pretty serious.
Get annual exams and put emphasis on basic routine checkups. Copays are a lot cheaper or next to nothing compared to ER visits for the same services.
So an ounce of prevention is worth a pound of cure. Goes the same for the pocketbook.
Prevention and education resources are easily accessible, like healthgrades.com, All Payer Claims Database, ColoradoMedicalPrice.org or ComedPrice.org, and the CHA, Colorado Hospital Association, among many others for your specific region.
Patients may underestimate how being good stewards of their own health care and making positive health choices can keep them out of the hospital and out of debt.
Now, we should mention that Memorial Hospital and UC Health President and CEO George Hayes sent a statement that we will have on our website along with this story, but declined to answer specific questions on camera about this topic. Joe and Lauren, back to you.
All right, very good. Very candid interview from the CEO
very.
there.
Yeah, I was pretty surprised.